Hello, everyone, and welcome to today's webinar with Cancer Support Community Los Angeles. I'm Kathy Riley, the Associate Director of Programs at CSCLA, and I'm honored to welcome you to this week's webinar titled Acupuncture as Complementary Therapy for Cancer Care, Efficacy, Safety, and Future Perspectives. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients and caregivers and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you'd like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. And before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. You may, however, enter your questions into the Q&A feature found at the bottom of the Zoom window at any time. Questions will be answered at the end of the presentation. We may not be able to get to all of your questions today, but our presenter will share her contact information at the end of the webinar. Dr. Lucy Postolov was born in the former Soviet Union and received her medical degree with a specialty in neurology. In 1995, Lucy obtained her master's degree in acupuncture from Emperor's College in Los Angeles, and in 2019, her doctoral degree from Pacific College of Chinese Medicine. She's been practicing medicine for the last 35 years and is the first acupuncturist to receive treating privileges at Cedars-Sinai Medical Center over 20 years ago. She founded her CBD company, Canopy Health, in 2018 to help her patients deal with pain and emotional problems. Dr. Lucy was awarded by the Los Angeles Business Journal in 2015 as one of the women who make a difference, and awarded Woman of Action by the Israel Cancer Research Fund in 1998. For many years, Dr. Lucy was on the professional advisory board of the Cancer Support Community Los Angeles. Dr. Lucy has been invited and presented at Cedars-Sinai Medical Center, UCLA, Tulane University, and many other medical centers. It gives me the greatest pleasure to introduce Dr. Lucy Postolov. Welcome, Dr. Lucy. We are so honored to have you here today.
Thank you so much, Kathy, for one wonderful introduction.
I will let you take it from here, and then I'll be back in a little bit for our Q&A portion.
Perfect. Thank you so much. So I would like to, first of all, thank Kathy, Edlin, Julia, and everybody in wellness community for inviting me again and again for the last 25 years to do the lectures in this wonderful community. And I also want to thank late Harold Benjamin, who started this community. One second, we're looking for slides. Sorry about it. All right, wonderful. Great. But before I'm going to start this lecture, usually when speakers are talking, they are doing disclosures that they don't have any personal interest in doing this presentation. I have to admit, I do have a very personal interest in working with cancer patients, and that comes, we have a term in medicine, wounded healer, and my wounds from cancer come basically from my birth. My mom was born, and when she was 3 months old, her mother, my grandmother, passed away from cancer, breast cancer. My mom also passed away when she was not even 61. I was married for 33 years to a medical doctor, fantastic man, and I lost him also to cancer. So all my life, although I never planned to become an oncologist or work with cancer patients, was dedicated, and my practice was dedicated, and still probably at least 60–70% of my practice are cancer patients. So for me, it is very personal. Now, from the beginning of time, it was 2 different types of medicine. The medicine which we call mainstream medicine today is only 200 years old. And this is chemotherapy, surgery, radiation, immunotherapy. You're all very much familiar with it. But there is also another medicine which is around 4,000 years ago. And now we call it complementary and alternative medicine. So this chart is actually giving you a great understanding of how long Western medicine was around, which is only 200 years. And it shows you also how long alternative and integrative medicine is in function. And usually history is the best judge. Everything what is not working, not staying around. And the medicine which is around for 4,000 years and still becomes more and more popular in the United States. And here I want to make a note that when I came to this country 35 years ago, acupuncture became legal in this country only for maybe 10 years when President Nixon visited China. Before that, you could go to prison for practicing Chinese medicine. In the Europe, where I basically came from, you have to be a medical doctor, and only then you can take additional continuing education in Chinese medicine. And that is how it worked in my life. I started as MD, specialty in neurology, and then I discovered the Chinese medicine, and that changed my life forever. I took a continuing education first in former Soviet Union, studied with Tibetan monk, and when I came to this country, I decided to practice only Chinese medicine. And I'm coming from a family of 40 medical doctors in 4 generations, and I'm the only one who is practicing Western medicine, Chinese medicine. Oh boy. So yesterday I received about probably at least 30 or 40 questions, and I tried to integrate those questions also in my presentation. So what is integrative oncology? Basically, integrative oncology is everything where you combine the Western medicine plus acupuncture, Chinese herbs, meditation, yoga, supplements, and etc. One of the questions was, what are the centers in United States where you can have acupuncture and Western medicine in the same time? So the leading oncology centers which are practicing integrative medicine are Dana-Farber in Boston, Memorial Sloan Kettering Hospital in New York, MD Anderson in Houston. They're starting, I just had an interview with them in St. John's Hospital, but it is just the beginning. In Cedars-Sinai, we had integrative medicine department about 20 years ago, and in 2-3 years, unfortunately, it was closed. There is an East-West Medical Center in UCLA, but none of those places specializing specifically in Chinese medicine and acupuncture. Chinese medicine and integrative medicine become more and more popular in the United States. If you look at this number, you see how over the years the numbers of integrative medicine in association with Chinese medicine are growing. Acupuncture right now is somewhere between 34+% for the cancer patients. Now, from China's point of view, I'm sorry about my voice. I was babysitting my grandchildren last week, and I guess I have something going on. So from Chinese point of view, acupuncture is related to stagnation of qi, blood, mucus, blocked emotions, heat. The external factors we usually talk about is smoking, chemically treated food, and negative emotions. I want to quote to you the text from 3,000 years ago, where they were trying to explain what is breast cancer is. And at that point, they didn't know about oncology, they didn't know about cancer. So they were saying that if a woman is married to a man whose mother or sister are very angry and demanding, this woman will build a resentment towards her family. And if her husband is not protecting her from the energy of her relatives, she will develop a stone in her chest. And if she will not express her anger, that stone gonna grow and go all over her body, and she will die. So basically, Chinese doctors knew about emotion connection to cancer, which I find fascinating. Now, how acupuncture works? From Chinese point of view, we have a system of channels and meridians, and you see on this sculpture of the man, a lot of channels, meridians, and points. There are over 1,500 points on human body. There are 12 channels and meridians. Each channel and meridian is associated with an organ and emotion. And there are more than 150 points on the ear. So in Chinese belief, when the energy is blocked, when emotions are build up and not released. We are creating the deficiency of energy or excess of energy. And by inserting very, very thin points, which are literally thinner than human hair, we are letting the energy to flow. So basically, this is the Chinese theory about how it works. But of course, Western medical doctors will not buy that explanation. But what was very interesting, a lot of different research was done in many very reputable institutions. And they did functional MRI, and they discovered when they would irritate the eye of the person with the light, with the flashlight, the same area in the brain, which is responsible for light, for vision, will lighten up on MRI. But also, if you're gonna place a point in body of a person, which is responsible for vision, the same area will also lighten up. They also measured the release of endorphins. And neurotransmitters are responsible for our emotions, for our energy, for our well-being, especially now after we all come out of COVID epidemic. We're all talking about adrenal glands being exhausted. And when we put the needle in a human body, could you give me a few needles, please? What happens, the connection between the needle and the energy from the needle, the signal from the needle goes into our spine first, and then goes into our brain in hypothalamus and thalamus. And they are the oldest structures of human body. I'm sure you heard about amygdala. It is the gland which is responsible for flight or fight response. And that's why we're experiencing fear, anxiety, and other negative emotions. But it is, in a way, our protective mechanisms from danger. But with acupuncture, for example, if that anger or that stress or fear, depression are not going away, using this very tiny, I don't know if you even can see it, I'm gonna put it very close to the camera, needles, in certain areas, we make our body to release endorphins, serotonin, dopamine, oxytocin. It's all the neurotransmitters which make us feel happy. For example, when we exercise, or when we're making love, when we're holding the child, we have all these positive neurotransmitters released. So this is basically how acupuncture works. Now, many years ago, National Institute of Health, which is a very conservative organization, came up with a statement about acupuncture being helpful for cancer patients, especially with post-operative pain, chemotherapy, and nausea and vomiting. So that made acupuncture legal. Acupuncture is FDA approved modality. You can charge and bill your insurance, and now even Medicare. It's also covered by many veterans programs. Now, exactly how will acupuncture help cancer patients? First of all, one of the most difficult time patients have are when they go through chemotherapy and have the side effects of chemo. And that would be First of all, the toxicity of central nervous system, insomnia, fatigue. You know that a lot of patients experiencing it, mood swings, feeling of loss of control, loss of appetite, weakened immune system. And acupuncture, by releasing all these wonderful endorphins, which I was just trying to understand a few minutes ago, they will help to deal with all those symptoms. Now, it's very interesting. We're talking these days about self-care all the time. And you can almost like buy self-care product everywhere on the internet, from crystals to meditation to essential oils. And I have to admit, a lot of them are super helpful. But self-care is much more than that. How many patients I have who would tell me, I spent yesterday in bed all day long, but it's okay, right? Because I have cancer and I just had chemotherapy. And I'm telling them, you don't have to have permission from anyone in the world to spend the day in bed if you're not feeling well, even if you don't have cancer. You don't have to have cancer to take care of yourself. So I would like to say that self-care is very important. Now, besides the symptoms which I already covered, we are dealing with others, with other symptoms. For example, a lot of men and women after chemotherapy or radiation become sterile, or women get into menopause. And although they're still young, but by doing chemotherapy, we shut down, especially if it's estrogen positive, progesterone positive cancer, we want to block their hormones so the cancer is not growing. So I work a lot with patients who had cancer in a very early age, then they recovered. And here I want to share one of my very favorite cases. I was working on a very young woman. She was 28, and on her honeymoon, can you imagine the horror of that? Her husband discovered a lump in her breast. So instead of having honeymoon, they returned home, and she was diagnosed with breast cancer. We went together through surgery, chemotherapy, radiation, other treatments. And then she disappeared. 3 years later, Ron tells me, you know, this patient gave you a call, and say, oh my God, I hope she does not have the relapse of cancer. And I was waiting for the whole entire day for call her back, because I take it very, very close to my heart. So finally I call her and say, how are you doing? And her first question was, Dr. Lucy, do you treat morning sickness? I say, oh, you're pregnant. So you can see how when we are treating patients with acupuncture, not only we can help with the symptoms of chemotherapy and radiation, we also can help with hormonal treatment. And this woman right now has 3 children. That's one of my favorite stories. A lot of patients after chemo will have diarrhea or constipation, and acupuncture is super helpful for that. We also have wonderful Chinese herbs to help. Postoperative pain, again, because when we do acupuncture, we release endorphin, and endorphin is a natural painkiller. It's basically like a morphine, but it is released by your own brain, so you cannot get addicted to it, and it is something healthy and good for you. Neuropathy is one of the most common complications after long chemotherapy. And if you start treating it earlier, Some patients will not even have neuropathy. Some patients will have neuropathy, but with acupuncture. And here I want to give you another secret. There are a lot of new research which is proving that infrared light, so you can just buy on the internet infrared lamp and put it every day for 30 minutes to your hands if you have neuropathy on your fingers or your feet, and that also going to help. We work with liver toxicity because I jokingly tell my patients that I'm your cleaning lady who cleans your organs from within, because cancer cells will die from chemo, but they're toxic and chemo is toxic, and we need to keep cleansing the body because most patients have 4-8 cycles of chemo and it accumulates in you. And I'm going to talk about end of life care later, how acupuncture and other modalities would help. So I was talking about that a lot of patients will be very emotional and they're gonna feel the loss of control, they're gonna feel anxiety. And besides using acupuncture, there are other modalities like meditation. I just read in last week, I believe, in one of the journals of oncology about how just 15 exercises a day, you're gonna lower your risk of cancer if you do exercises. People ask me very often how many visits you need when you go through chemo or radiation, and it will vary. It will vary from patient to patient. It will vary from what kind of treatment the patient has. Normally, if it is a very high level of chemotherapy treatment, I will suggest my patient in the week of chemo to come maybe once or twice. And then if there are 2 weeks in between of rest, to do it just once a week. One of the questions was, is acupuncture dangerous for cancer patients? And the answer is absolutely not, if your acupuncturist knows how to treat cancer patients. I'm going to talk later on about credentials, but I have to say that I consider myself very lucky because I started practicing Chinese medicine in this country. I went through Empress College. I went for my master's degree and Pacific College in San Diego for my doctoral degree. And I took enormous amount of special courses about how to treat cancer patients. Because if you're not familiar, one of the questions was coming from acupuncturists, how you start treating cancer patients. You need really to know how to do it because you do not want to spread the cancer cells. So let's say if patient has pancreatic cancer, I will never work on the area of the abdomen. If it is lung cancer, I never gonna work on the chest. If it is breast cancer, again, I never will work on the breast area. Seeing therapist is very helpful because you need to talk to somebody, and cancer support community offers a wonderful free of charge therapist treatment. Taking Chinese herbs, keeping a journal, being in touch with your loved ones, having a really good night of sleep, and etc. is very important. I'm going to talk about use of CBD oils a little bit later. Again, what is the risk and what is the harm associated with non-conventional approaches? Once I had a patient who came to me and he had colon cancer in stage 2. And first thing he told me after I did intake, I don't want to be treated by Western medical doctors. I don't believe in chemotherapy, surgery, radiation. I think it's so toxic for my body. And I just want to be treated by energy and acupuncture and herbs. And my answer was absolutely not, because I always work as a team with medical doctors, surgeons, hematologist, oncologist, radiation therapy, because I don't believe personally in the heart of my hearts that it is safe to treat acupuncture only with energy treatments. And I believe that nobody is that good who treats patients with energy, with acupuncture to conquer cancer. Cancer could be very, very aggressive. And for that reason, I believe in a team work with medical doctors. Now, what kind of requirements are there for acupuncturist who works with oncological patients? First of all, it will be like for any other. In the United States, in order to become an acupuncturist, you have to go through special school, and it's usually full-time 4-year program. You have to take boards. It's a special, very tough exam, and there are national board and there is state board. So in California and New York, it's not enough just to take national board, you have to take also state board. And that gives you the master's degree. If you want to do doctoral degree, it is additional 2 to 3 years of training. I think it's very important that the person who is working with you has some general medical training. It's very hard to find MD and acupuncturist in the same time, although there are some people which are called medical acupuncturists. It's usually medical doctors who honestly went through like 6 weeks, very Mickey Mouse course. And I don't believe in medical acupuncture, because to really understand it, you need between 4 to 6 years of specific acupuncture, Chinese medicine training. It's very helpful to be affiliated with the hospitals. I was the first acupuncturist in Cedars-Sinai 25 years ago who was invited to be on staff. And they even didn't know how to process my documents. And first time I came to Cedars treating patients after surgery, everybody would just stand around me looking like I'm from like a Martian with all those antennas and didn't know what I'm doing. Now Cedars, I believe, has 6 acupuncturists in the whole entire hospital. Some hospitals don't allow acupuncture at all. I think it's super important to have great communication skills and have a chemistry with your practitioner. It is almost like a marriage. If you don't have chemistry, if your doctor does not understand your pain, your despair, it's not a good doctor. So I think, and I'm examining the patient, but patient examines me on the first visit as well. This picture actually shows me in Cedars-Sinai. This is the robot who brings medications to patients. And again, like I said, it's very important to have special training in treating oncology patients. I was super fortunate. My master, who I followed for many years, was Giovanni Maciocia, who did a lot of courses on treating oncological patients. Unfortunately, he passed away a few years ago, but in Pacific College, there are all his lectures. So for those acupuncturists who want to help patients with cancer, they should listen to all his lectures and read his books. There's another doctor who probably is not practicing anymore, but wrote a lot of wonderful books. It's Mikishima. He was trained in China. He's Japanese by ancestors. He is fluent in Chinese. He translated one of the most important books in Chinese medicine. And those are my masters. Now, I feel that food is super important when you go through the surgery, when you go through chemotherapy, radiation, and I have this separate lecture just on that subject. Unfortunately, I have only 45 minutes for this presentation, and then I will take questions and answers. So I will go very quickly through these slides, but if you want, you can call my manager, Ron. The number will be in the end of this lecture, and he's gonna send you the whole lecture. But food as a medicine is deserving a completely separate lecture. And if there is an interest about how we recommend to eat and what to eat, please ask that question later. So there is a different food recommendation before surgery, after surgery, during chemotherapy, after chemotherapy, during radiation, with the side effects. And again, I'm gonna go very quickly through those slides, basically scan through them fast. But again, you can request us and we're gonna send you this lecture. Now, I find also very helpful to show my patients, and I started doing it even before COVID. During the COVID, we would do a lot of telemedicine where I would help my patients through internet to use those points. But this picture, for example, Splints 6, shows you how to build your energy and how to release the toxins from your body. So if you're gonna put 4 fingers next to medial malleolus on your foot and go a little bit inward from the bone, you're gonna feel there. That is the point Splints 6. That point helps you with nausea. That point helps you with energy. So I recommend my patients either use Moxa. Moxa is a special, very thin cigar. And now we don't use it that much because they found that Moxa actually can cause lung cancer because it is toxic, the fumes of it. But you can massage that point and you can use a pen with a laser light. Now, there are other very important points. Pericardium 6 is also very easy to find. So if you're gonna look at your hand and put 3 fingers from the point where you bend your wrist, so 3 fingers, and then you're gonna feel 2 tendons, which are like guitar string, and you press that point. It's one of the best points to stop nausea. It's also one of the best points to calm your spirit. So if you're experiencing a lot of anxiety or nausea, just massage that point. We use that point also for morning sickness. We use this point for people who have nausea while they're traveling. Now, my favorite point to build immune system, and it's so classic, it's called stomach 36, or we call it Zusan Li, which means 3 extra miles. In older days, they would measure the energy of the person by how many miles they would be able to walk. And they found that when you stimulate that point, you can walk 3 extra miles. So I tell my patients, When you massage that point, and you see the picture on the leg, it is below the knee. Again, it's 4 fingers. It's your 4 fingers, not practitioner 4 fingers. And a little bit lateral from the bone. You're gonna feel that point. So I recommend people who go through chemotherapy, radiation, have low energy, build their immune system, because we need to build the immune system because we need to fight cancer. Not only chemotherapy and radiation and surgery, we need to fight our own cancer. So I love those points to stimulate your own energy. And finally, kidney 1. It's also very easy to locate. If you're gonna see your foot, you see how there's a pink skin and white skin, and right where the pink and red skin meet, if you're gonna press very hard. I actually, twice in my practice in 35 years, got the patients out of coma. That is how much energy that point will stimulate. Now, a lot of people ask me a question, are Chinese herbs safe? And that comes usually from Western medical doctors, because they are under impression that Chinese herbs are either effective hormones, and some are, for example, deer antler, never prescribed to cancer patients, or even with caution for patients with a family history of cancer. So the formula Chemo Support was designed by my mentor, Giovanni Maciocia, and he did also a research on every individual herb in this formula. He did the research on animals, but nevertheless, that all those herbs do not get in conflict with any kind of chemotherapy. So I'm using Chemo Support almost all the time for my patients. Now, radio support. Unfortunately, a lot of radiologists will be against using Chinese herbs. And I always recommend you to communicate with your doctor, talk to them about it. I personally will call your doctor and explain to him what the formula does. I'm going to send them materials showing them that the formulas are not working against chemotherapy or radiation. Here you see formula classic Chemo Support, radio support, Buzhong Chitang, which I love very much for patients after surgery when they have low energy, and then in post-surgical chemoradiation period just to build their immune system. Lately, we hear a lot of conversations about CBD and mushrooms. I'm not talking right now about psychedelic mushrooms. I'm talking about mushrooms like cordyceps, shiitake, mayaki, turkey tail, and etc. You can see a lot of information about how Chinese herbs, because all those mushrooms are basically coming from China, Japan, and other Asian countries. I'm very picky when I choose the company because not all mushrooms are organic, not all of them are grown or picked in the right season. And the most important thing, the extraction out of the mushrooms. You can't eat mushrooms every day in a huge amount, but you can take, and I personally take one peel of these 5 mushrooms every day just to keep my immune system, because I'm seeing patients with cold and other conditions every day. Lion's mane is my favorite formula, is my favorite mushroom for brain fog. A lot of patients complain about brain fog. So lion's mane is great for brain fog. It also showed in research that taking this formula can help patients with dementia and Alzheimer's disease. So that's another wonderful mushroom to take. Now, CBD. You can buy CBD right now anywhere from dispensary to gas station. And of course, they vary in quality and they vary also in price. If you're looking for a good CBD company, make sure that that company is prepared to give you the independent lab results. That is very important. Why? Because the company can write on their labels anything. Right now, it's not regulated by FDA, and I don't know if it will, because this is also extract from Chinese and Indian herb, which is over 4,000 years old. But the good company who will be responsible, gonna make sure that independent lab will give you the full report telling you that there are no pesticides, there are no heavy metals, there are no E. coli, there are no other toxins. And I think it is super important to have that document. And they're supposed to test every single batch for that. One of the questions was, would CBD get in conflict with chemotherapy and radiation? The answer is no, because only antioxidants, to the best of our knowledge right now, may get in conflicts, but there are no antioxidants in CBD. Now, a lot of people will ask me a question, and by the way, I started studying CBD because of you guys, because of cancer patients. I did not learn anything about cannabinoids during my 7 years in medical school. Even in Materia Medica, which is like a thick book, it's like 1,700 pages on cannabis, has only one page, and the only one property there is that the seeds can cause laxative effect, while in reality, CBD has thousands of wonderful effects. It can help you with nausea, with anxiety, with insomnia, with pain. Now, there are different proportions of CBD and THC. And what I consider incredibly important is that you don't want to be high, right? You want an effect, you want a clinical effect. So for those who want to get high, they should go to dispensary and buy whatever they want to buy with high content of THC. I personally use CBD, which has only 0.3% of THC. And the reason for that, there are cannabinoid system A and B. We are born with cannabinoid system, as we are born with blood system, endocrine system, nervous system. Somehow nature installed in us cannabinoid system. So to get to both receptors of A and B, you need at least a little tiny amount of THC to give it kind of a good pathway. And that's why that's the CBD I personally recommend and use. Now, there is a lot of new talks about psychedelics, and especially psychedelics in treatment in cancer care. At this point, psychedelic therapy is legal in the United States, I believe only in 2 states. But in Italy, in Spain, of course, Native American Indians and Chinese and Indian doctors were using psychedelics, especially psychedelic mushrooms, for special spiritual effect and special spiritual understanding. So a lot of companies, private companies especially, right now doing a lot of research on the use of psychedelics for especially depression, anxiety, PTSD, and cancer care, especially in patients in the end of their life, so they're not afraid of death, and their whole perspective of death and dying is changing. If you want to know who are the institutions who are doing right now, and I'm talking about not private companies who are making money basically on patients, but on reputable institutions like, again, Dana-Farber in Boston, University of Washington. Stanford has a huge psychedelic program. Also, Cancer Center in New York, University of Nebraska, they all are doing right now clinical trials with different dosage of psychedelic drugs, but it has to be done under doctor supervision. So I do not recommend you to go to some shamans or to some spiritual lodges and to have mushrooms. It could be toxic. I don't think they reported any deaths in the last 3,000 years. However, first of all, I would definitely consult with your MD if you're a candidate for that. There are macro doses which must be performed in a medical environment, because patient, when he gets in psychedelic experience, it can be from 6 to 8 hours. You have to have a specially trained specialist if you're doing it. There is also microdosing, which also used for depression and anxiety. But again, there are tons of information on PubMed and other medical sites, and you see that even NIH now are publishing information about psychedelics and patients with cancer. So I know that I had very little time. As a matter of fact, it's time for me to start taking questions, but if you have any questions, you can call us, you can email us. Ron is very good about answering it. I'm very generous with my time. I don't charge for answering questions. So this is all the information about how to get in contact with us. This is bibliography, and I just used one page because I don't want to overwhelm you with too much information. But that is just a drop of the bucket of information and knowledge which stands behind every word I'm saying. And finally, it's my favorite Chinese expression that in the battle with the disease, there are 3 warriors. One is the patient, and to represent the patient, I put the hand of a patient with IV of chemotherapy. There is a doctor, and the doctor, by doctor, I mean not only oncologist, it's going to be your oncologist, it's going to be a surgeon, it will be your acupuncturist, it's going to be your psychiatrist, your therapist, and the patient. If the doctor and the patient will become a team, the disease will be conquered. time for questions.
Dr. Lucy, thank you so much for that informative and meaningful presentation. I know I learned so much.
Thank you so much. I'm so honored to be invited. And as I told, working with cancer patients, I consider my biggest mission in life. It's my passion. I have a great deal of compassion to every patient, to every caregiver, because I've been a caregiver for my mom and my dying husband who had 2 different cancers. One of them is not treatable at this point. So I have so much understanding of what people go through: despair, pain, facing unknown, not knowing what kind of doctor, what kind of healer, what kind of acupuncturist, herbalist to go to. So I'm here, I'm available, I'm happy to help everyone who needs my care.
Thank you. We have just a couple of minutes left in our time together, and we've received a couple of questions. So I'll send those your way right now. Someone is asking about, can an acupuncturist put needles only in your hands to get the best results? They have some struggles with lymphedema and can't have the needles in their legs. And so wondering a general recommendation for
well, as I said before, first of all, acupuncturist has to be trained in treating patients with cancer. It is not the same as treating your average patient. So there is no one size fits all treatment. It will depend. Now, I know that a lot of doctors feel that they cannot put needles for patients with lymphedema. And I personally don't believe in it, because I showed you already how very thin are the needles. Yes, you cannot have hypodermic needle. You cannot check your blood pressure, but you can use acupuncture needles with lymphedema. And yes, you can use only distal points, and they don't have to be just on the hands or on the feet. I'm using a lot of points in the ear, in the head, in the face, on the chest. It all depends on what kind of cancer it's going to be. But yes, if your doctor feels strongly that you shouldn't use the needles on the site of lymphedema, then you can work with distal points in other parts of the body.
Wonderful, thank you. There's a question about the cost of alternative medicine. Is that, and I think you mentioned this in your talk, but if you could share it with us again, is the cost of alternative medicine covered by Medi-Cal or Medicare or supplemental insurance?
Well, they just passed the law about a couple of years ago about acupuncture being covered by Medicare. Now, Medicare covers very small amount of the fee of acupuncturist. Many insurances also will cover acupuncture, but cover just a small fraction. But most insurances these days, they will cover acupuncture again. Normally, if it is the beginner acupuncturist, maybe they're gonna charge $75 to $125. If you want somebody who is very seasoned and has doctoral degrees and 30, 40 years of practice, their prices will vary between $200, and I heard about doctors who even charge $500. Personally, I'm not in that category. I'm trying to make it affordable to my patients. So basically, it depends on insurance. You always should check it with your insurance. Medicare will cover, Medi-Cal, I believe, does not cover acupuncture, but it is case by case, depending on your insurance, basically.
Great, thank you. And then one final question. A couple of individuals have been asking about the acupuncturist who was your mentor and the lectures, and also any books that you recommend. Are those in your reference slide? There was one acupuncturist that you had spoken about who was your mentor and that you trained under him. Individuals are wanting to know the name of that person.
Well, basically, to be honest with you, I had many mentors in my life. I was super lucky. When I was in former Soviet Union, my mentor was a Tibetan monk. So I know a lot from him. I followed Giovanni Maciocia. Any acupuncturist who has his license would know Giovanni, because we all studied his books. He wrote a book about psychiatry, about gynecology, about OB, general acupuncture, the points. Basically, any acupuncturist who went through legitimate school would know Giovanni. Again, I don't believe Giovanni wrote a book about treating cancer patients, and that's why I said, get his tapes, because he was, for at least 20 years of my practice, I followed him while he is Italian by ancestors. He was born in England, and then he moved to California. He also had a house in Positano, and all the best books on Chinese medicine are written by Giovanni. But I don't know any books he wrote on Chinese medicine for cancer, so I would get his lectures from Pacific College of Chinese Medicine, because they keep the library of every speaker in the last 35 years. And I go to those symposiums every single year, because if you want the greatest and the best doctors, once we had a lecture of the doctor who is treating Dalai Lama. Now, Kiko Matsumoto, she wrote a couple books. Mikishima wrote the book, again, not specifically on cancer. He has about the, I believe, divergent medicine, on I Ching and Chinese medicine. But again, his lectures, I'm sure, also in Pacific College of Chinese Medicine in the library. So there are tons of books, but I cannot tell you that there is one book I would specifically recommend to become an acupuncturist who is dealing with cancer patients. I'm sure that question comes from acupuncturists. And if they want to give me a call and talk to me about it, I'm going to share with them more information. Those books are not for a layperson. They are very technical. So I would not say that if you're a cancer patient, you should read that book. It's too complicated. But there are a lot of books on cancer and alternative medicine, and they're listed in my bibliography.
Thank you. Well, we appreciate that detailed information, and we have reached the end of our time together today. And I would like to thank you, Dr. Lucy, for your time, for sharing your expertise with us. And I also want to thank our attendees for your engagement with us today and for your participation and thoughtful questions.
I also want to thank every cancer patient, and I know how hard you fight. I also want to thank every caregiver, because I know what a difficult journey you have being with somebody who suffers with cancer. And I also want to say that wellness support community is an incredible organization. I feel so privileged and honored to do 2-3 times a year my lectures. Before COVID, it was in person. Now it is through the Zoom, because you guys are helping so many people. And the support when people go through cancer can't be underestimated. It's so important. As a matter of fact, I did a study which shows that patients who are supported by their community, by their relatives, by their loved ones, have a higher rate of survival. That's why I think what you guys are doing is incredibly helpful.
Thank you. Yeah, thank you for that thoughtful comment and for the reminder for everyone who's involved in someone's cancer journey. If you would like a copy of today's slides, please email us at info@cancersupportla.org. And the recording of this webinar will be up on our website, most likely next week. And you can find that in our video library at cancersupportla.org. And thank you, everyone. And we'll see you at the next webinar. Have a great day. Bye.
Thank you. Bye-bye.